Ricedo a questo punto la parola alla dottoressa Levinson che ci farà parte dell'esperienza canadese fin qui acquisita. Grazie mille.
So hello again. This time I'll just share a few of the things that we've been doing in Canada that might be useful as examples that you might want to draw from, because I think you've heard a lot of the themes over and over again, so I'll just highlight some different things. To start with, we're in English and French, so we have everything in our two languages. Our French province, Quebec, came up with the name Choisir avec soin, which we particularly like. You're welcome to use it, because it sort of means choosing carefully, but maybe caring also. So that's, we have all our materials translated into the two languages. You've seen our slogan, which is the same as what I showed you earlier, and our campaign approach with the 4 planks. But I have to say, we have a challenge that I think you have in Switzerland, because even though we have a single payer system in Canada, we really are 13 provinces and territories. That's less than you have in your cantons, but it's still a lot. And care is really delivered and decisions are made at a provincial level. And so we have a national campaign, but delivered in many provinces. And that's been an important challenge for us. So I'll share a few of our strategies. One of the things that we think has been very important is to try to communicate visually a lot of the things we're doing and be able to show our progress. So I'm not a very great social media person, but my office tweets and is very involved in social media and create these things called infographics to show what we've done. So we have a list of the number of recommendations. We're over 200 now, 45 societies. We involve all the provinces and territories. But I want to show you a few specific things. Our Early Adopters Collaborative, which I would encourage you to think about. And I'm going to talk to you about our medical students. So once you've kind of got the lists, which are national in our case, the challenge is to get them into practice. And so what we have found is that one strategy that's worked for us is to have monthly webinars with all of these these are just different places in Canada. Vancouver Coastal is out in Vancouver, British Columbia. North York General is in Toronto. Alberta is the whole province of Alberta. All of these different groups are trying to learn from one another about how to actually get the recommendations into practice. So we get on the phone once a month and we have one of the organizations showcase how they're actually putting the recommendations into practice. And actually just last week, we had 72 organizations on the phone in the webinar trying to learn from one another. So I'll give you an example. So this is North York General. This is a very big hospital in Toronto. And they have really been committed to implementing Choosing Wisely. They got all of their leaders together and said, we want you to pick one thing in your area from Choosing Wisely that you want to change. And they have a patient council, their patients were involved. Every computer screen in the hospital has this on it. And so they try to remind people in many ways. One of the areas they thought was a big problem for them was in their emergency department. They had a very high use of laboratory tests. I don't know about you, but if you go into an emergency department in Canada, it's hard to leave without phlebotomy. So often you get blood drawn before the doctor if anyone asks what's wrong with you. So they did an implementation of Choosing Wisely with educating their physicians, educating their nurses and patients. And they looked at the overall use of laboratory tests in the emergency department in a pre and post design. And what you see in the blue bar is the amount of test ordering overall. And in a pre-post design over 6 months, and they've continued this work, they dropped the ordering of tests by 41%. So they've done this. They've also done it in other areas of the hospital, not with as dramatic amounts of decline, but in x-rays, et cetera. But what we would do in our early adopters collaborative that you might think about is we'd have the hospital get on the webinar and explain how they'd done this and show their early results, because much of this isn't published yet. And this shared learning across our provinces has been very helpful and might be something you want to consider in Switzerland. Now we're creating, I'm just going to show you a number of things we're doing. We're creating something called the 10 Million Challenge. So we need to show our government that we're making changes, and so much is going on around the country, we don't actually know about all of it because it's very grassroots and ground up. So we've created this campaign, 10 Million Challenge, help prevent 10 million unnecessary tests and treatments. And so you can register, get a starter kit from us, pick a target you want to work on. That could be the blood transfusion or whatever is relevant, could be the emergency department lab tests. You implement it and then tell us how you've done, because we want to bring all of these experiments happening in the field together to be able to measure collective impact. And some might be measuring transfusions, others blood tests, but we want to put it together in some way through this 10 million challenge. And we're constantly trying to find ways to inspire people to get engaged. And so this is one of the strategies we're using. Another thing we're doing is trying to create a lot of tools that make it easy. We have an app. You guys are welcome to translate it into any language. It's online, it's free, and it allows physicians to quickly look things up through a use of an app in English and French at the moment. This is something I want to tell you about that I'm really excited about. I mentioned that medical students have been working with us. We have found, and I bet you will find this too, or maybe you found this already, medical students are very, very interested in choosing wisely. They see all these things that we do, and they kind of wonder, well, why do we do that? I don't really know, but my attending physician expects it, and they won't like me. They'll think I'm a bad trainee if I don't order it. So we have worked with students, and they created an organization called Choosing Wisely STARS. It stands for Students and Trainees Advocating for Resource Stewardship. And if we can engage the students early on, we think this is a really great strategy, and we're not doing it, we're just helping them to do it. So one of the first things they decided is they were going to create a list of things students shouldn't do. So here's the student list. We haven't actually released them publicly yet, but you're getting to see them for the first time. 6 things medical students should question. And they're not disease specific, they're behaviors. Like just for example, this one, don't suggest ordering tests or treatments preemptively for the sole purpose of anticipating what your supervisor would want. That's because, that's what our students do. They learn it from us. So don't suggest ordering more invasive options before considering less invasive. So our students have created this list, and now they're creating a club, basically, in each medical school to try to, we have 17 medical schools in Canada, to try to disseminate this message, all with student leadership. So it's a kind of energy you might want to harness. I mean, I'll give you another little example. One of our trainees at a hospital noticed that every patient, our trainees often have to do quality improvement projects. Well, one of them noticed that all the patients in the hospital get a urinalysis and a urine culture, like many of them, but no one ever uses the urine culture results. So his quality improvement project was that instead of sending the result of the urine culture back to the chart, he convinced the laboratory to just send a note that said, "We have your urine culture results, call if you want them." And then you're all guessing how many people called, which is actually 0, And they followed up to see if the patients survived. No one died of urosepsis. And then he got the hospital to change the way they handle urine cultures, because just everybody was getting a urine culture that was never used. So it's a great source, because our students see all these things, and they become very interested in doing projects on these kinds of topics. So I just want to share a few more things about, I mentioned, measuring. We think it is really important to measure attitudes because this is a culture change. Of course, we have to change practices, but we've been measuring, and we want to continue to measure attitudes. So this is Ontario, that's my province's family physicians. And we can look that most of them think that patients drive the inappropriate use of services. So especially our primary care doctors think that they're kind of pressured by patients. They think that the recommendations will benefit patients, over 90%. They do think that they agree that primary responsibility for ordering tests lies with physicians. And then we're, of course, monitoring what percentage of the doctors know about choosing wisely. I won't spend time on this. We've talked about it. It's the major reasons that they think it's hard to implement choosing wisely. All the kinds of things we talked about before, like the lack of time for shared decision-making in primary care doctors. The main reason, they say, is patient requests for tests and treatments. That's why we have to do the patient education campaign. So we also monitor patient attitudes, and it's something you might want to think about doing. We found in an independent survey done by a polling company that 9% of the patients in Canada knew about choosing wisely. But it's very interesting. A third of patients, not a third, over 60% of patients believe that 1/3 of care is unnecessary. So they kind of know that we're doing a lot of things that might not be needed. And so we can, again, but many of them, over 90%, said they need decision tools. Like, they don't know when they go in and a doctor orders a test if it's needed or not. So they wanted more help in those decisions. Interestingly, just to say, we asked them, has a doctor ever recommended a test that you did not think was needed for your health? A quarter of them said yes. But look what they do. 44% said they asked the doctor whether the test was really necessary. Maybe they do or maybe they don't, but they report they do. A third ignored the doctor's advice. Those are the people that took the prescription we gave them and ditched it in the garbage can when they left the office. And a quarter of them took the test or treatment even though they didn't think it was needed. So we don't actually know that our patients are doing this, but we want to look at whether we can shift these attitudes over time. We're developing lots of posters that we think are funny to try and get the message across playfully, like this hot dog. More is not always better. That's the words that we're using over and over with patients. Here's another one, a washing machine. We have this as a videotape where the suds overflow, and we're putting them in family doctors' offices in a variety of places to try and get patients' attention. We have the 4 questions that I showed you before. So we've really had a journey. We started with the lists. We're now working on implementation with our early adopters collaborative. We're trying to develop measurement. We have a Canada-wide information system called Canadian Institute for Healthcare Information, where we're trying to show where the same thing, the small area of variation of which provinces are doing better than others. And we're launching our 10 million campaign to try and move this ahead. And I think one of the challenges once you get it going is you have to keep the energy up. How do you keep people engaged in trying to work on this over and sustain it over time? So that's one of the things that, we haven't solved it yet, but we're working on it. And another challenge is really how to engage our public and patients in a culture change, because it's clearly a very big task. The strategy we're using in Canada, because we don't have enough money to do a huge campaign, is to try to focus it on family doctors' offices. Because in Canada, about 75 to 80% of patients do have a family physician. And so what we're trying to do is provide all these materials at the point of care so that family physicians can hand them out to patients when they're discussing individual decisions. And we're putting videos in waiting rooms. We have screensavers in the exam rooms while patients are waiting for the doctor to come in. They might as well read something about this. But this is an ongoing work, and I think one that's a big challenge for all of us. So I'll stop there. Just some highlights of what we're doing in Canada.